Hi, I'm Mark Walker. I'm the editorial director here at the FinTech Times, and we're here at the first ever Money 2020 Middle East in Riyadh. First off, I'm going to ask my interviewee to introduce himself to you, the audience. Please introduce
Thank you.
yourself.
My name is Sheneamer. I'm the Chief Business Development Officer at Bupa Arabia, the leading healthcare and insurance company.
Thanks very much for joining us today. What I'm really interested in talking about a little bit today is your Care Connect product, because obviously we're interested on the financial movements of things and obviously digital transformation. Can you give us a bit of an idea of how it simplifies access to sort of medical support for people within the kingdom?
Bupa Care Connect is the latest addition to Bupa Arabia. As you know, the conglomerate Bupa Group globally is a specialized company in health care and insurance. It has operations spanning from Australia to Latin America to Europe and Asia. So we are innovating from deep expertise within the healthcare services. Bupa Care Connect is a digital first clinic complemented with physical clinics. And the idea here is you want to have a full view on the journey of the patient. In today's situation, patients, they can go to different hospitals and clinics, and you get bits and pieces of their history throughout. And doctors in different hospitals, they don't know what this patient took in the previous hospital, on what medication he was on, etc., etc. So this results in disconnected history, and also the experience of the patient and the healthcare outcomes are not optimal. So Bupa Care Connect, the whole idea of Connect is to have a connected care model where you have a full view on the patient with a focus on chronic population, which is one of the biggest challenges we face in Saudi Arabia. Saudi ranks in the top 5 on all chronic conditions. And they tend to be the most visitors to the hospitals repeatedly. So they have a higher frequency of visiting hospitals. Usually, if they are not managed well, their conditions will deteriorate. And this results in admissions at hospitals and complications, and obviously higher cost of treatment, and hence higher insurance cost. So Bupa Care Connect is connecting the different pieces within the healthcare delivery system with a single view. It has its own doctors, Saudi consultants and specialists. They engage proactively with chronic patients within our book to enroll them into the different care pathways and care programs developed under Bupa Care Connect. They try to service them while they are at home or at office through teleconsultations, through home lab tests. So they will send you someone home to collect blood samples for analysis. Then a doctor will call you and review the results with you. They automatically send you your medications periodically to your home, so you will never run out of medications to ensure that you are taking medications on daily basis. If you need to see a doctor physically, then they will refer you either to their own clinic. The first clinic will be opened in Riyadh in Q4 this year, with more clinics will be opened over the coming couple of years. Or they refer you to one of their partners in hospitals across the kingdom, where Bupa Care Connect team are there stationed, aware of you. So you come without the need for pre-authorization. They know your case, easy in and out. You get the service that you want, and off you go. To ensure the optimum customer experience and when you receive care, whether digitally or physically. And the focus of Bupa Care Connect is to maximize the healthcare outcomes. We are more incentivized as an insurance company to keep people healthier. If you are healthy, then we pay less money to treat you. So we have the right incentive equation versus any other player in the health ecosystem.
Yeah. And I guess obviously being here at Money 2020 and thinking about the Saudi Vision 2030 around being more cashless, being more embedded finance sort of options, I guess that's a seamless integration into the Care Connect product as well. Does that enable patients and users to take advantage of more digital payment techniques to pay for their insurance and various other things?
Today, health insurance in Saudi is mostly B2B. So you as an end member, you are covered through your employer. So they pay for your full health insurance. The only payment that you end up paying could be the copay contribution at the hospital, which is collected by the hospital, not the insurer. And that is done today cashless, and the transactions in Saudi are mind-blowing. I mean, I don't remember the last time I actually withdraw cash from a machine, probably pre-COVID. However, we are, from the insurance side, we are also integrating other services. So sometimes there are services that are not covered by insurance. Okay, we want you to be able to actually get these services, and you pay for them directly through our app if they're not covered. Also, getting the employers who are buying insurance through our digital sales portal to be able to pay for the insurance through the different solutions available from our partners, whether installments, buy now, pay later, etc., etc. So all of these are being currently integrated into our platform to have more choices and more solutions available for our members to either pay for their insurance or pay for services, healthcare services that are not covered by insurance.
And I guess the word that we're all talking about these days is super app. So the idea with the Care Connect product is that everything is done within one app, and that then supports obviously the vision for digital transformation, financial inclusion, and everything else. Is there more items that you think you'll be adding into that sort of application and way of working?
Yeah, it depends. I mean, we always look at what are the missing services, what our customers demand, because we have multiple channels to collect feedback from our customers on the services they wish to have and to be made available. For example, incentivizing members who are active. So we try, currently we are developing a gamification experience within the app. So you get incentivized for taking care of your health, for being active, etc., etc. So you get incentivized to stay healthy. These are all being integrated, whether built in-house or through the integration of multiple partners. And during this conference, we have signed multiple agreements with stakeholders across different industries to enable us to, one, collect the right data about our members, whether normal information about their age in their cities, where they live, etc., etc., or healthcare data that we obtain through mostly our government records. Saudi is now embarking on the unified health record for every citizen. So that enables us to actually collect wealth of data to analyze and deploy artificial intelligence into the predictive analysis, because that's actually more important than treatment. If I can predict and prevent conditions from happening, and that only can be done if you collect the right data and you structure them in the right format to be able to predict the future.
Yeah, and I guess we wouldn't be living in the here and now if we didn't talk about AI. And I guess that's sort of an area that you'll also be looking at as well and seeing how that can be brought in to support further developments.
Technology for Bupa Arabia and Bupa Care Connect is a pivotal pillar into our strategy moving forward. We have actually invested in the infrastructure of the company in the early days because we know the future will be in the digital and AI. There are still challenges from a regulatory point of view when it comes to AI models. The financial, because we are under the financial sector today, the use of AI and the data storage outside Kingdom still has limitations. However, we have seen global players coming to Saudi, establishing their local operations such as AWS, Google Cloud, Alibaba, and the likes, which will enable the entire financial sector, including insurance and Bupa Arabia, to actually double down on AI because you get the blessing of the regulators. Because data is localized, you can train the AI models on local data, and this is actually, this is the future for us, and the investments moving forward would be mostly in that space.
Fantastic. And then final question, obviously we're here at the very first ever Money 2020 here in Riyadh. What's your thoughts about the show?
This is our second time to participate, by the way. So we participated in the previous event last year. and we decided to participate this year because one, we exchange knowledge within the different partners in the space of technology, whether fintech, insurtech, health tech, etc., etc., and to showcase how we are using technology in creating a customer experience that is seamless for our members, connecting the digital with the physical care provision, and ensuring that we maintain better health for our members, and we provide them with services at the convenience of their homes or offices through different channels.
Fantastic. Thank you so much for joining me today.
Thank you for having me.